back. In today's medical moment, we're talking about monoclonal antibody treatments for COVID-19 and who qualifies for them.
Registered nurse Sarah Haley with USA Health joins us now to talk about what's available at the Civic Center. Thank you so much for joining us. If you would tell us, how do the monoclonal antibody treatments work and how they go about helping these COVID patients?
Okay, so the monoclonal antibodies are just man-made antibodies that we infuse into your system, and what it does is it mimics the same thing your body does when it makes any immune response to fight off a virus. So we're just doing it for you with this medication. So it goes in there, it fights off the virus, and really you have three goals: to decrease the viral load, so like the more virus that develops, we're trying to cut that down. You want to decrease the amount of symptoms you develop or how severe they get, and prevent hospitalization.
Okay, so tell us, who qualifies for these monoclonal treatments at the Mobile Civic Center?
Okay, so right now we actually have two forms of treatment that we're doing as far as who qualifies. Either way, you have to be over the age of 12 and weigh at least 88 pounds. And then we're doing it for COVID positive patients, so somebody who knows that they've had COVID and are considered high risk for developing severe disease or symptoms. And then we're also doing therapy for those who have been exposed to a known COVID positive and then also are at risk for severe progression as well.
What kind of feedback have you received from patients who were sick with COVID and then received this treatment?
So it's actually been surprising feedback. Most of them are just caught off guard at how well they feel and how quickly they feel better. I think a lot of them think that they're still going to have to go through that long progression, but most of them are feeling better by the evening or the very next day. And many of them have reported specific symptoms that they noticed really were relieved after they got the infusion, like their appetite had returned or the cough had gotten better or something like that.
How long does the treatment actually take, and how long does it take for you to receive the infusion?
So it's a pretty streamlined process. You come in, the infusion itself is only a 30-minute infusion, and then we keep you for an hour after the infusion just to make sure that you don't develop any symptoms or have any kind of a reaction or anything like that. So overall, about an hour and a half total, but the med itself, it only takes about 30 minutes.
That's pretty quick.
It is.
Yeah, it is.
Sarah Haley with USA Health, thank you so much for your time tonight.
Yeah, thank you.
Now,